The purpose of this session is to share the learning from a Safeguarding Adults review, or SAR, by Trafford Strategic Safeguarding Partnership in July of this year. I'm the independent author or independent reviewer. I've been doing and completing Safeguarding Adults reviews and sister reviews, child safeguarding practice reviews and domestic homicide reviews for over a decade. So let's get underway. Mike is the person at the heart of the review's real name. When we asked Mike's parents to suggest a pseudonym, they said they'd prefer the name by which he was known to the family, Mike, short for Michael, to be used, and the Safeguarding Partnership in Trafford agreed. So there's some slides which just set out Mike's story, his contact with agencies prior to his sad death, and then I'll touch upon some of the learning themes. This is a discretionary Safeguarding Adults review. A Safeguarding Adults board, in Trafford's case it's referred to as the Strategic Safeguarding Partnership, must complete a Safeguarding Adults review. In other words, it's mandatory, and that's when it involves an adult with care and support needs and who's died as a result of abuse or neglect, or is still alive having experienced serious abuse or neglect, and there's reasonable cause for concern about how partners work together to safeguard the person. I think it was felt that given that Mike's death was not the result of abuse or neglect, in other words, he took his own life, there has been an inquest now and a conclusion of suicide was reached by the coroner, that this didn't fit the criteria for a mandatory Safeguarding Adults review. But fortunately, the Care Act gives Safeguarding Adults boards the opportunity to conduct a Safeguarding Adults review on a discretionary basis, where it believes there'd be value in doing so. This may be where a case provides useful insights into the way organisations are working together to prevent and reduce abuse and neglect of adults. So that was the decision taken. So this is a discretionary Safeguarding Adults review. So Mike, he died in August 2023. He was born, as you can see there, in 1987. He was a citizen of the planet, really, because he's a UK citizen, but he was brought up by his parents along with his siblings in Malaysia. So he was 35 years old when he died. He was educated in Malaysia. His parents still live out in Malaysia. I've had contact with them for the purpose of this review and just have to make sure I get the time zones right. But he attended boarding school in the UK, as you can see there, for his GCSE and A levels. He's got paternal grandparents and a paternal aunt who live in the UK. As I've hinted, his mum and dad, Mike's mum and dad, decided to contribute to the review. There's no obligation on family members to contribute to a Safeguarding Adults review, but they decided to do so. And it's always really, really useful when family members decide to contribute, because you just get a much better idea of the person at the heart of the review. Because with the best one in the world, the records that our partner agencies collect don't always tell you so much about people like Mike as a person. So it's good to have their input. And they told me about his personality, that he was a kind and generous person with a heart of gold, and initially had aspirations to be a pilot. He obtained his private pilot's license in Australia before he learned to drive, and later his commercial pilot's license. But the significance of that training for his commercial pilot's license was that he began to experience quite a lot of stress on that particular course. in particularly in relation to night flying. And this does seem to be quite an important issue in Mike's life, because it seems, certainly with the benefit of hindsight, that the workplace was a place of considerable stress and anxiety, and may well have exacerbated his mental health problems. There's references in the record shared with the review of him becoming very anxious about the nature of the work, the pressures placed upon him, worries that his colleagues were talking about him, and even during the pandemic, when, as we all know, many services moved to virtual working, including in Mike's employment, that didn't really ease things for him. He was still very anxious about the workplace, what people thought about him. And as I say, this seemed to exacerbate his mental health issues. His parents said to me that until quite late on, they were oblivious, to use their word, about the severe stress that employment generated for their son Mike. They were aware that he became stressed, but they weren't aware of the extent of it. And of course, their contact with their son, they living in Malaysia, him living and working principally in the UK, but moving around the globe at times with his work, meant that their contact with him was by phone or FaceTime. So they didn't have as much face-to-face, in-person time with him as they would have liked, and that might have helped them to understand the depth of his worries and anxieties about the workplace. They said that he first accessed private medical support for psychosis during his 20s, and as we'll see in a moment, he came into contact with mental health services in Greater Manchester during the pandemic. However, they said that Mike didn't like taking medication for any type of illness, preferred herbal remedies, and they described him as a very spiritual person. They also said, and this is their words, not mine, that he was a fantastic believer in conspiracy theories. So I guess that gives some hint of the way Mike's mind worked, perhaps a little suspicious of the medical model, medication, and I think that influenced his willingness to take and adhere to prescribed medication regimes. So that's a bit about Mike. Right, so this is July 2020, and as we'll all remember, there was a bit of a lull after the first lockdown, if you remember. The media talking about July the 4th, 2020 as being our Independence Day, when everything would open up again after the first lockdown. Anyway, that was the first time, that's the first record I've got in the review of him coming into contact with mental health services. So he was detained under Section 136 of the Mental Health Act, which, as we know, gives the police the power to detain someone who's in a public place, who appears to have a mental illness, is in need of care and support, to take them to a place of safety. He was seen near railway tracks, putting himself in danger near railway tracks, not from the point of view of standing in front of a train or anything like that, but just touching the train lines to check whether they were live or not, he was saying. Anyway, he was detained. He was admitted to hospital under Section 2 of the Mental Health Act, and his admission lasted for 19 days there, and he was diagnosed with psychosis. And following his discharge, he was cared by one of the, I think there's 2 Salford community mental health teams. So if I've got that wrong, apologies, but it was the Ramsgate House Salford community mental health teams. as a standard patient. So he didn't have a care coordinator, so he was mainly seen for outpatients appointments, or rather not seen, because they were mainly by telephone during that period of the pandemic. But he stopped collecting his medication from July 2021. So that's a year on from being detained under the Mental Health Act. He got a really good relationship with his GP in Salford, because at that time he was living in the Salford City Council area. Moved to the Trafford Council area sometime in 2021. So he was being supported by the Salford Community Mental Health team as a standard patient. But he stopped taking his medication, and bit of a system issue here. His GP practice in Salford got no system for checking whether patients are ordering and collecting their medication unless they're flagged as needing assistance to do that, to order and collect medication. And Mike was not flagged in such a way. So the fact that he wasn't collecting his medication wasn't spotted for quite a bit of time. He was smoking cannabis and drinking alcohol, but declined referrals to Achieve. That's the GMMH substance use service. And he persistently declined referrals to Achieve over the course of the period the review focuses on. And then we fast forward to November 2021, and he's detained again by the police under Section 136. This time he's by now he's moved to the Trafford Council area, and he's found naked, meditating in a public park. He's locked himself out of his flat. Doesn't really have any plans for how he's going to get back into his flat. And in any event, the police decided to detain him under Section 136, and as previously, there was a visit to hospital under Section 2 of the Mental Health Act. It's worth pointing out here that the GMP officers had access to the Greater Manchester Mental Health Tactical Advice Service, or known as MHTAS for short, which is a service to the GMP Force Control Room, and they offer support from to the call takers, GMP call takers and officers, from mental health professionals to help the police deal with mental health issues. I'm not sure how that's going to be affected by Right Care, Right Person, which we'll talk about a little bit later on in the review. But the benefit of MHTAS is that if the police contact them for advice, as they did on this occasion when they were talking to Mike in this park, they were able to look at his medical records, see that he was under mental health services, that he'd not attended his last appointment, his last outpatient appointment, or not answered the phone for that appointment. And following contact with MHTAS, the police decided to detain him. So he was detained in hospital for nearly a month, as you can see, till the 9th of December 2021. He repeatedly asked to leave, and as you can see from the slide there, he was quite guarded, suspicious, and tended to isolate himself and could become quite agitated and aggressive and abusive at times. He was generally felt to lack insight into his mental health, and as I said before, reluctant to take medication. This is a constant theme in Mike's contact with mental health services. And I think in Mike's case, it was partly to do with his belief system, that he just didn't like medication. And he said the medication made him feel drowsy. Anyway, by the 9th of December, he's ready for discharge from hospital, and he's referred back to the same community mental health team in Salford, but this time not as a standard patient, but for care coordination. But there was a delay in allocating the care coordinator, and she wasn't allocated until the 28th of February 2022. So that's nearly a 3-month delay. So there was a delay in completing his care plan, risk assessment, and crisis plan. And this, the difficulty in recruiting care coordinators in sufficient numbers is a problem, I think, for GMMH, who provide community mental health services in Salford and Trafford, but I think for mental health services across the country. So once the care coordinator was up and running, Mike engaged very well with her, but he got the support of one professional with whom we established close links. And I think that makes such an importance to people who are vulnerable in some way. And that professional, in Mike's case, was his Salford GP. He really got to know his Salford GP well. The Salford GP, from the records I've seen, knew him very well, understood him, and Mike seemed to be prepared to talk more openly about his mental health issues and the sort of things which were having an impact on his mental health with his GP than anybody else. But sadly, his GP retired in around March 2022, and that link with one trusted professional, which I think can be so important, was unfortunately lost. However, he got on well with his care coordinator, who worked really assiduously to try and support Mike, because there'd be periods when he'd stop his medication, paranoia would increase, and the care coordinator helped him to see that when he stopped his medication, he became unwell, and so he'd restart his medication, but it was a bit of a stop-start picture. He was getting command auditory hallucinations, as you can see there, telling him to harm himself, and having suicidal thoughts, but he always said that he wouldn't act on them. He started a new job in May 2022, and we can see that the stress levels went up, feeling very stressed at work, burned out, having been thrown in at the deep end, worried about colleagues talking about him, and his alcohol intake began to increase. And his care coordinator around June time became more worried about him, and GMMH have got a zoning system where, depending on the zone, the risk assessment feeds through into the zone in which you are supported. And so he went from a green to amber zone. So in other words, his risk went up and the support that was provided to him increased for a time. She was also thinking about referring him to the home treatment team at that time. Now, just as things were coming to a bit of a head with Mike then in June time, his GP practice in Salford decided to deregister him. They'd been aware that he'd moved from Salford out of their, it's not the right word, is it, but catchment area for that GP practice, you know what I mean, to Trafford council area, but they'd kept him on their roll. I don't know whether that was because his GP had got such a positive relationship with him, knew that he was struggling with his mental health. I don't know whether that's the case or not, because I've not been able to speak to his GP because he's retired. But anyway, they decided to deregister him, and so Mike then received 4 weeks' notice of that and re-registered with a practice, but not in the Trafford area. It's Cornbrook GP practice, which I think is on the border with Manchester and Trafford, but it's actually in Manchester. And so he registered with his new practice on the 4th of August 2022. Next slide, please, Claire. And so, having moved GP practice from Salford to Manchester, and having moved physically the previous year from Salford to Trafford, the community mental health team decided to transfer him to Trafford North Community Mental Health Team. But despite their best efforts, they didn't manage to do it. It was quite a protracted process. It started off with Salford Community Mental Health Team completing a transfer of care letter and sending it to Trafford North CMHT. His Salford care coordinator, if I can say it, going to a Trafford MDT, multidisciplinary team meeting, to give a presentation, to talk about Mike's needs. But having done that, there was no care coordinator available to allocate to Mike at the new community mental health team in Trafford North, and the transfer didn't take place. That situation was complicated by the fact that Mike left the UK in November 2022. He planned to go home to Malaysia for an extended Christmas break, spend some time in Australia, but eventually turned into quite a long travelling period where he went to Vietnam and Cambodia, I think, and didn't actually return to the UK until sometime in February-March 2023. So his care coordinator in Salford, who'd actually moved on to another job now, not care coordinating, she kept him on her caseload, even though she was no longer a care coordinator, until she could try and make this transfer to Trafford North happen. But the fact that he was out of the country now meant that Trafford wouldn't accept him until he returned to the UK. So the tentative plan initially was that when he returned to the UK, the Salford care coordinator would see him and check that he was willing to attend an initial consultation with the Trafford North Community Mental Health Team. So then we get to February 2023. By this time, Mike's been out of the country since November, and his care coordinator is beginning to wonder when he's going to return to the UK. And so at a Salford Community Mental Health Team MDT, they decided to discharge him to his Manchester GP practice. That's the 22nd of February. And they wrote to the GP practice, but unfortunately in the letter, they asked the GP practice when Mike returned to the UK and presented to his GP again, to re-refer him not to Trafford North Community Mental Health Team, but mistakenly they put Manchester North CMHT. I noticed in quite a bit of the correspondence over that period of time, Manchester North had been mistakenly written down instead of Trafford North CMHT. It was just a mistake that crept in, and then how these things happen, kept being repeated. Unfortunately, Salford CMHT wrote a second letter to Mike's Manchester GP just less than a month later to advise that he'd been accepted by Trafford Community Mental Health Team, which was incorrect. So that second letter was incorrect, but it confused the GP practice because not surprisingly, they went with the most recent instruction, if you like. They'd had a letter saying, "We've discharged him to your care. Can you re-refer him to Manchester North CMHT when you see him again, when he comes back to the UK?" The second letter said, "He's actually been accepted by Trafford CMHT, so you don't need to re-refer him." So they went with their most recent instruction. So that was unfortunate. It was a bit of a mix-up at the Salford CMHT. So Mike's back in the UK in March, and he's seen by his Manchester GP on the 16th of March. And that's the only time that his GP practice, his Manchester GP practice, to which he transferred the previous August 2022, actually laid eyes on him. He was seen by a nurse practitioner. This was for a physical health check for patients with a mental illness. And during that consultation, he said that he stopped taking his medication for his mental health medication, and so the practice nurse arranged for a GP from the practice to phone him to discuss that. But when the GP phoned him, he was unable to get a reply, and Mike had no further contact with his Manchester GP prior to his death. So he's now no longer connected to any mental health service in Salford or Trafford, but he gets a job in Gibraltar. I've not told you what Mike did. As I say, trained as a pilot, but he eventually qualified as a building information modelling BIM draftsman. Now, I don't know anything about building information, but when I looked it up, when I Googled it, it seemed to be about bringing all the various parties together involved in building design. So it sounded quite a technical job. Within a very short time of taking on this new job in Gibraltar, he's admitted to their main mental health hospital, Ocean View Hospital in Gibraltar, under their local Mental Health Act. Now, I've had a look at the Gibraltar Mental Health Act. Gibraltar is a British territory, as we know, and their Mental Health Act is modelled on our Mental Health Act. It's very similar, and quite a lot of the practitioners, quite a lot of the doctors I noticed working at the Ocean View Hospital in Gibraltar had previously worked in the UK NHS. So he was admitted to the hospital. He presented, I think, at A&E 3 nights running, very shortly after starting this job in Gibraltar. And then he was admitted under Section 2 of the local Mental Health Act to the hospital in Gibraltar. So we can see this work-related stress cropping up again for him. And after a short time, his psychiatrist in Gibraltar, his responsible clinician, contacted both Salford CMHT and Trafford North CMHT to tell them that he was detained, and that's the psychiatrist from Gibraltar, would get back in touch. It was agreed with Trafford North CMHT when he was due for discharge, because it was anticipated that when he was discharged, he'd probably return to the UK. And a plan was put together. Well, it looked to be quite a good plan. The CMHT said, right, well, when you let us know what his discharge date is, we'll arrange for the Trafford North home treatment team to support him on his return to the UK. And we'll arrange for a joint assessment of Mike by the Salford CMHT, to whom he was well known, and Trafford North CMHT, to whom he will be hopefully transferring. So there was a plan put in place. However, the plan relied on the Gibraltar psychiatrist contacting Trafford North CMHT as arranged, and he went off sick. And whoever was filling in for the Gibraltar psychiatrist at the time of Mike's discharge didn't get in touch with Trafford North CMHT or the UK. So he was discharged from the mental health hospital on the 5th of June 2023 and returned to the UK 3 days later. They've got the equivalent of our home treatment team that were to support him in his flat in Gibraltar. They were unable to make contact with him and closed his case. We were told that the population in Gibraltar is quite transient. It moves around, that people move around quite a bit. And so it was not unusual for a person to be referred to the equivalent to their home treatment team, not be there, and to have left and moved on somewhere else. So he's back in the UK in June, no contact with mental health services, and no arrangements for his repatriation because Gibraltar have not been in touch with us. So I'm now just going to cover the 3 days leading up to Mike's suicide. He died on Friday, the 25th of August, 23. This is Wednesday. He twice visited Stretford Police Station and spoke to the inquiry counter officer there. He reported being stalked and harassed by his neighbours, and the inquiry counter officer felt that Mike seemed to be really struggling with his mental health. He left the station the first time he went because he was worried that he'd be sectioned, and this, I think, was a constant preoccupation for Mike. He didn't want to go into hospital under the Mental Health Act again, and so was very cautious about what he shared with professionals in order to avoid that. So he feared he'd be sectioned, but he later returned. So he came back a second time to apologise for having gone off without giving his details, and now he provided all his details. But he assured the station counter officer that there was no danger of his taking his own life. JMP contacted the ambulance service and asked them to send an ambulance to Mike's address once they'd got the address. But when he was contacted by NWAS, he declined the ambulance and he denied any thoughts of suicide, as you can see. And so the decision not to send an ambulance was confirmed. However, GMP decided to also carry out a welfare check. So they visited the flat he shared with his flatmate, but he wasn't at home. They got his phone number, as you can see, and he wouldn't say where he was, but he said that he was safe and well and had no plans to harm himself. Now, GMP planned to submit a care plan. GMP's care plan, not to be confused with a care plan in adult social care or community mental health team care plan, but they complete a care plan to the police where they come into contact with a vulnerable adult who may need input from other partners. So that was a bit of a missed opportunity. However, NWAS, a mental health professional within the NWAS control room, sent an email to Trafford North CMHT, which was a good thing to do. Unfortunately, they decided to send it to a named manager in the Trafford North CMHT who was actually away. So that message wasn't received or acted upon. So it's a bit of a lesson there about making sure that you send emails to the generic team email rather than individuals. So that's Wednesday. Thursday, no contact with agencies. And now we're through to the day of Mike's death. Now, his flatmate, who incidentally is trained as a mental health nurse, but was not working as a mental health nurse at that time, small hours of the morning, as you can see there, rang GMP via the 999 system to report that Mike had left the flat with a kitchen knife, and he'd said that he was going out of the flat to kill himself. So officers responded very promptly. They located him not far away from his flat, but couldn't find a knife. So it's assumed that he must have discarded it somewhere. The officers who attended had a search around, but were unable to find it. And they didn't feel that there were sufficient grounds for detaining Mike under the Mental Health Act. As I said, Mike was very, very motivated to avoid being admitted to hospital under the Mental Health Act. So he may have been quite good at providing with the right answers to the questions asked by the police officers on that occasion. So Mike's flatmate got up in the morning, go to work, and he tried to persuade Mike to let him take him to hospital. But Mike wouldn't go with him to hospital A&E. So flatmate had got a very tough decision to make. He decided to go to work, but keep in telephone contact with Mike, whilst also trying to get some kind of support for Mike. So from work, this is 9:55, he rang the GMMH helpline to tell them that Mike was feeling suicidal and to seek their advice. And the advice given, as you can see there from the Trustwide helpline by the mental health practitioner, was to contact emergency services if Mike presented a risk to himself or others. In other words, to contact primarily the police to attend, or the ambulance service. And when they checked Mike's records, they felt that he didn't appear to be under secondary mental health services at the current time, which was technically correct. Although, you know, as we know, attempts to transfer him from one community mental health team in Salford to a mental health team in Trafford had been ongoing. So Mind contacted Mike by phone at 10:13. He'd contacted them the previous week for help and advice, principally, I think, on the prompting of his dad. As we know, Mind are a charity, non-statutory service, so perhaps Mike felt a bit more confident about contacting Mind, and that, you know, as a non-statutory service, he wouldn't be putting himself at risk of being sectioned. And they invited him to a workshop, but he didn't attend. So they've made a follow-up call on this morning, and they've advised the review that there was no indication during that call that Mike appeared to be approaching a crisis. Quite a lot happened on that Friday. So we're now at lunchtime, and we've got the flatmate still at work. He's contacted Mike about 12:45, and Mike said he wants to end his life, didn't see the point in carrying on. So Mike phones GMP again via 999 to relate this conversation he's just had with Mike. And he also told GMP about the call that he'd made to them at 4:34 in the morning. But to be fair to GMP, they quickly accessed the details of that call. Now, GMP assessed the call as a medium risk and created a grade 2 incident. What's a grade 2 incident? Well, grade 1 is immediate response for the police. Grade 2 is the next one down, and that's priority response, i.e. within the hour. And they correctly contacted NWAS to request an ambulance attendance, and NWAS created a category 3 incident. What does category 3 mean? It means that the ambulance service aimed to respond within 2 hours on at least 9 out of 10 occasions. And at the time, I think it's still the case, the ambulance service control room gave GMP an estimate of how long the wait time would be before they'd get to Mike. And they anticipated at that time that it would take them an hour and a half, i.e. well within the 2 hours. And then at 13:44, a GMP sergeant, I thought it was a GMP sergeant, that's what I was told, but at the inquest, and I'll talk about the inquest in a little while, I found that it was actually a constable who was acting as a sergeant, closed the incident that GMP had created following the call from Mike's flatmate at 12:58, because she felt that the ambulance service were best placed to deal with the incident. So the police intention to attend within the hour on a grade 2 priority response incident, that was cancelled. We're getting further now into Friday, the 25th of August. So NWAS, they'd been contacted by the police. They contacted Mike's flatmate, and they had a discussion about what the paramedics may be able to achieve when they attend, because paramedics have got no rights of entry, unlike the police, who can force entry in certain circumstances. So can the fire and rescue service in certain circumstances. The ambulance service can't. They also talked about where if Mike was deemed to have the capacity to be able to decide whether to attend attend hospital or not, that he could decline to attend hospital. And so the upshot of that conversation with NWAS was that Mike's flatmate was provided with the daytime telephone number and the out of hours telephone number for the approved mental health professional who would carry out a Mental Health Act assessment. And it was also suggested to Mike's flatmate that he might ring his GP. So At 3:35, the flatmate phoned the daytime AMP number, and that takes him through to Access Trafford. And as probably people on the call know, that's a call centre which receives calls and emails from the public about all manner of Trafford Council services. Now, the flatmate who contributed to the route told me that when he rang that number, he thought he was getting straight through to the AMP, the Advanced Mental Health, Approved Mental Health Professional, but instead he got through to a customer relations operator in Access Trafford. He explained to the customer relations officer that he was extremely concerned for Mike, as he got schizophrenia, lots of suicidal thoughts, and he requested this mental health act assessment, which he thought he was, going to be put through to the AMP for, and asked that someone should call him back urgently. Now, what the customer service officer did was pass the information through to the Adult Safeguarding Hub, and the Adult Safeguarding Hub, not the service manager, but the Adult Safeguarding Hub, assigned the contact to a hub social worker for an urgent mental health act assessment. Now, this was picked up by a busy social worker. It's a Friday afternoon, usually in a pretty intensely busy time. She just returned from another call. She's not an AMP, as you can see there. And when she looked at the information to hand, she concluded that GMP were aware of the concerns and that the right people were already dealing with Mike to enable him to access support around his mental health. And so that contact was closed. When I say closed, there was a follow-up plan for the following day, or perhaps Monday, for the Adult Safeguarding Hub to check in with the police to see if there are any further information about Mike. At 4:06, by this time, Mike's flatmates decided to return home, and he's returned home to find Mike dead or dying, having stabbed himself in the chest several times. And so he rang the ambulance service, and you'll see the ambulance service, having initially estimated it would take them about an hour and a half to get to Mike, they've not managed that. And as we probably, everyone on the call's aware, the ambulance service post-COVID have wrestled with very high demand on the service, and also system challenges arising from delayed discharges of patients from hospital. So the ambulance service have been unable to respond to that Category 3 call to Mike within the 2 hours anticipated, certainly not within the 1.5 hours which they'd estimated to GMP. Massive efforts were made to try and save Mike's life. I'll receive the details of the advanced life support efforts. Managed to get his heart restarted, but they were unable to save his life. Now, at 4:10, whilst all this is going on, Manchester Mind, and you'll recall that Mike had been in contact with them, and Mike's dad, who's in Malaysia, knows his son's been in contact with them, and has become increasingly worried about Mike on the basis of the content of the telephone calls he's had with his dad and his mum from Trafford to Malaysia over the last couple of days. He sent an email at 10:24 that morning to the National Mind email address, marked, as you can see, critical, my son Michael, to say he was very worried about him. Unfortunately, that's not passed on to Manchester Mind from the Mind HQ, for want of a better word, until 4:10, by which time Mike's dead or dying. Manchester Mind then emailed Mike's dad in Malaysia at 5:18 and confirmed that Mike had been in contact with them, couldn't disclose any further information, and told him that they weren't a crisis service, and posted him to the GMMH crisis line and Blue Sky Trafford. But just to share the flatmate's observations, he shared a flat with Mike for 2 years. He confirmed to me that they were about to be evicted, but it wasn't. It was 2 weeks away. The flatmate, had found somewhere else for himself to go to. And he'd said to Mike, look, until you find somewhere else, you can stay with me. But he said that Mike had a lot of issues paying the rent and that financial troubles were a big source of stress for him. He felt that employment was a trigger for Mike's mental health issues, as you can see there. He said that he came from a high-achieving, very successful family, 3 siblings, and he was desperate to please his dad, who was again had worked in high-status employment. And he felt that Mike went for more demanding jobs than perhaps was necessarily good for his mental health. He added that he was baffled that Mike wasn't detained by GMP after he made the report to them in the small hours of the morning of the day that Mike died. And despite the fact he's a trained mental health nurse, so he is in a better position than an ordinary member of the public to try and secure support for Mike, he did find the whole system for accessing support for Mike to be quite confusing. Righto, so move on to the key learning themes then. The next slide then. So is Mike's mental health act admissions in the UK. So one in 2020 and one in 2021. And as I mentioned, the GMH policy of notifying a patient's carer with their consent within 24 hours of admission may not have been complied with. So that relates. So there's a recommendation there for the Safeguarding Adults Board to ask GMMH for assurance that their staff comply with that. The GMMH themselves, when they produced their report for the review, felt that Mike could have been allocated an independent Mental Health Act advocate, particularly as his main support network seemed to be in Malaysia on a different time zone. I noticed that the CQC in their annual review of mental health services noted that patients who are admitted to hospital under the Mental Health Act weren't being referred to or allocated an IMHA sufficiently. So that's the second recommendation. And I also noted that there was a delay in allocating Mike a care coordinator following his discharge from that second Mental Health Act admission, November-December 2021, and a delay in allocating a care coordinator seemed to prevent or delay the transfer of his case from Salford to Trafford. And again, I noticed that this is a national issue, difficulty in recruiting sufficient care coordinators, highlighted when the CQC last inspected GMMH. So given that it had been highlighted by the CQC and GMMH had got a plan to respond to that CQC inspection recommendation, I didn't make a recommendation in respect to that. Yeah, the plan, I mean, I guess this just shows how easily a really quite good plan can break down. You know, the Gibraltar psychiatrist and the Trafford community mental health team had put together the beginnings of a good plan, but it was undone by the consultant going sick. I don't know whether there were any other factors in Gibraltar because they're carrying out their own internal investigation, which has not been shared with us yet. So recommendation 3. Recommendation 4 was that Trafford should share this Safeguarding Adults review report with the authorities in Gibraltar and ask them to reciprocate by sending us the outcome of their investigation. And what GMMH found when they looked at their patient repatriation policy was they got quite a good policy where they were repatriating mental health patients from the UK to other countries, but it didn't provide enough guidance when patients were going in the opposite direction, i.e. from abroad to the UK. So their they're reviewing and rewriting their patient repatriation policy, because you could argue, with the benefit of hindsight, and that's the thing that I have as an author, I have the benefit of hindsight, that when the Gibraltar psychiatrist didn't contact Trafford North Community Mental Health Team, it might have been beneficial for that to have been followed up by the Community Mental Health Team in Trafford with the authorities in Gibraltar, notwithstanding that it had been agreed that Gibraltar would contact us. Mike's Salford GP practice removed him from the practice list, and I can't see any indication that, apart from writing to Mike to give him 4 weeks' notice, tell him that he could appeal, that they didn't take account of his health and well-being at that time, or contact his care coordinator. Because if they had contacted his care coordinator, the care coordinator may have advised against deregistering him at that time, because the risks were increasing. He'd gone from green to amber zone. His care coordinator was considering the involvement of the home treatment team. So recommendation 5 is for all GP practices across Greater Manchester to take any risks that a person they're looking to deregister on the grounds of moving address, to take account of any risks the patient may be facing at that time, and to consult with the services that their patient is in contact before finalising that decision. I think that would have been helpful in this case. And the process, as you can see there, of transferring Mike from one CMHT to another CMHT within the same mental health trust became unnecessarily protracted. Obviously, it was complicated by the fact that Mike left the country in November, I think, 2020. Yeah, November 2021, and didn't come back till November 22. I'm getting my years mixed up, and didn't come back till the following February, March. But it just seemed to consume a great deal of time and effort. And GMMH, when they reviewed the case, felt that Mike's case should have remained with the Salford CMHT until they'd verified that he'd returned to the UK, rather than discharging him to his GP practice. And the GP practice to which Mike transferred, which was Manchester, but on the border with Trafford, they only saw him the once, and they struggled to engage with him. And when they looked at their policy for registering new patients, it doesn't include the option of offering a face-to-face appointment or any process for identifying whether that new patient's got vulnerabilities or risks. So again, we've made a recommendation there that all GP practices across Greater Manchester should have a process in place for identifying vulnerabilities and risks in respect of new patients, and to prioritise such patients, those with vulnerabilities and risks, for an in-person consultation. Quite a lot of learning for the response to the increasingly desperate efforts of Mike's flatmate to get support for him on that very difficult day, Friday the 25th of August. And GMP felt that it would have been best place for them not to have cancelled attendance at that call. Looking back at it, and Access Trafford, when the flatmate contacted them to request a Mental Health Act assessment, they didn't follow their policy at the time. It's now changed, of requesting GMP to carry out a welfare check, and they didn't respond to the flatmate's request for a Mental Health Act assessment. The understanding of the review is that the person contacting Access Trafford who's requesting a Mental Health Act assessment, their details will be obtained, and they'll be passed through to the advanced mental health practitioner to review that information and contact the person, or in this case, the person contacting Trafford on the person's behalf. But when I was at the inquest, sometimes I get called to inquests when the report is considered relevant. There was a strong focus at the inquest on the decision taken by the acting sergeant to cancel police attendance at the call on that Friday lunchtime. And there was concerns that she might have been influenced in making that decision by the principles of right care, right person. This is the process which I think was implemented in Trafford a couple of months ago now, whereby the police are looking to ensure that they only attend mental health call-outs where there is an immediate risk, and that a large number of the call-outs they've previously attended in respect of mental health issues, which they feel don't require police attendance, should be attended to by the appropriate service. It's been quite a controversial change, and I know during the course of this review, quite a number of professionals expressed some concerns about it. But in any event, the acting sergeant was unaware of right care, right person, and it didn't influence her decision making. But as I say, at the inquest, there was a lot of focus on that decision. But in my view, decisions taken much earlier had made it a bit more difficult for agencies to respond as effectively as they might like to have done to Mike's flatmate on that difficult Friday. Particularly Salford CMHT's decision to discharge Mike to his GP rather than keep hold of him, and then the breakdown of the plan to repatriate Mike to the UK from Gibraltar. So there were two key decisions taken there much earlier than that terrible day on Friday, the 25th of March 2023, which made it more difficult for agencies to respond to the concerns about Mike. And so the SAR, the Safeguarding Adults Review, has been advised of the new 5-step approach to responding to people who are presenting as suicidal. That's been clarified to the review, and one of the recommendations I've made is that the Safeguarding Adult Board in Trafford should obtain assurance that process has been successfully implemented and is working effectively. We were also advised that there was a group doing further work to develop Trafford suicide response guidance, and we wanted to share this report with that group. Right care, right person. As I mentioned to you, when this SAR was commissioned, there was worry that the right care, right person principles might have informed GMP actions on that 25th of August, when the acting sergeant decided to cancel the call and rely on the ambulance service to attend. Because the right care, right person principles have been well advertised, they've been talked about in the national press, they've been implemented in other force areas. But in the event, no evidence was found that the sergeant had been influenced by right care, right person principles. But as I said earlier, it became abundantly clear that several partner agencies have got concerns about the implementation of right care, right person, which is, as you know, is now in. And I've been advised that Trafford, through Gaynor McGinty, the strategic lead for mental health, is monitoring cases very carefully to see if there's any adverse impact as a result of implementation of right care, right person. With hindsight, and speaking to Mike's parents and his flatmate, it became really clear to those of us involved in the Safeguarding Adult Review that anxiety and stress in the workplace was a really big issue for Mike. And it probably wasn't anywhere near as clear to the professionals who were working with Mike at the time, who might have seen the fact that he was in employment as, a protective, as a positive factor. And as I say there, the stats suggest that this is quite a significant problem in the workplace. There's quite a lot of initiatives already in place to try and support employees in the workplace when they're experiencing anxiety, stress, and mental health problems. And this is also a duty on employers to provide support to their employees, their staff who are experiencing mental health problems. I think, though, in Mike's case, his flatmate said that he felt quite a lot of shame about his mental health struggles and may have been reluctant to disclose them to his employer, and reluctant to do so in case it affected his employment prospects in that job and in future jobs, given that he'd be relying on employers for references. But we felt that the learning about the impact of workplace stress on Mike should be shared with Trafford Suicide Prevention Strategy so that they could develop some additional measures, strategies to tackle this issue. And last slide, I think, is good practice. Lots of good practice in this case. The pilot scheme, which involves mental health practitioners from GMMH and Pennine Care, who are the providers of mental health services across the Greater Manchester footprint. Those practitioners working in the NWAS Emergency Operations Centre. Mike's Salford GP provided excellent continuity of care. It's such a shame that that link was broken when he retired, and there may be a connection between the retirement of the GP who knew Mike well and the decision taken a couple of months later to remove Mike from the GP practice. I mentioned the role of MTAS, Greater Manchester Mental Health Tactical Advice Service, who provided good advice to officers dealing with the incident when Mike was detained under the Mental Health Act in November 2021. Incidentally, they weren't consulted, MTAS, during that call out during the early hours of the morning when the flatmate rung GMP to say that Mike had left the flat with a knife intending to kill himself. It was explained to me that it's up to the call taker in the operations room to seek advice for officers attending a mental health incident if it's required. And I felt the Salford Community Mental Health Team Care Coordinator engaged really effectively with Mike, given that Mike, was very wary of taking antipsychotic medication, would often stop and then start again. And there's some difficulty in getting him to appointments. I thought she engaged with him very well until he left the country in November 2022. And then another piece of good practice that I was informed about was the introduction since April 2024 of the NHS 111 number, and then press option 2 for people who are experiencing distress, anxiety, agitation relating to mental health services, which quickly gets them access to someone on the phone who can try and provide them with advice and support. And the 111 option 2 had been chosen because it was thought to be a simple number to remember for someone who was in distress. So that's another piece of good practice. So I've got 3 questions. You can read them on the screen there. Could we possibly adopt a more flexible approach when people with vulnerabilities move short distances over boundaries? Are our services sufficiently accessible for people with suicidal ideation or family members or friends, in this case flatmates seeking help, for people who are actively suicidal? And I wondered how Right Care, Right Person was going so far, or whether it was too early to say. Thank you very much for joining and listening. Much appreciated.